Thank you. I'll just take you quickly through the informal food market, which is actually, there are many analogies with medicine, but there are also quite substantial differences. I'm going to quickly run through some of the latest and perhaps surprising findings, talk a few words about lessons learned, and then finish with ways forward. So first, it's the enormous burden of foodborne disease. Nobody knew it was as big as that. It's comparable to malaria, HIV, AIDS, or TB. And that has come as a shock, which still hasn't found its way into the policymakers or into the public. Secondly, where the burden is coming from. And the great majority of it is in developing countries, 98%. And most of that is coming from fresh foods sold in wet markets, fresh foods sold in informal markets caused by biological hazards. Again, people don't know that. What we often say in food safety is what you worry about and what makes you sick and kills you is not the same. People are worried about GMOs and pesticides and aflatoxins and things which are pretty negligible in the scale of things. Part of that is from an unhelpful focus on hazard, not risk. People don't want anything called toxin in their food, but they don't think in terms of burden, probability, severity. That's what we heard about yesterday. And if you can just switch that mindset from hazard to risk, a lot could be achieved. Because one of the interesting facts which has come out from many of these studies, including done by ILRI, is how the Pareto principle prevails. It really is a case of the vital few and the trivial many. In most places where we work, a few diseases, maybe 3-5 out of the 3,000 which could make you sick, 3 or 5 are causing 50% or more of the burden. That makes it more manageable. The last message on current findings is it's getting worse. And I was one of the authors of that report, which Steve and Spencer talked about. And while many things are nicely getting better, malaria is down, AIDS is down, maternal deaths are down, and there are many reasons for this, but foodborne disease is bucking the trend, and it's complicated as to why that is, but the worst is yet to come. So that's some of the status, that is some of the status quo of food safety. So what have we been learned? One thing is we haven't learned very much because we've been looking in the wrong places. As we heard, so much of the focus has been on trade and so little has it been on the domestic markets. And yet the domestic markets is where the huge burden is happening. I'd say there's sort of 3 areas which have been looked at most. The first is the whole regulation legislation, which is the subject here, and we can't regulate our way out of food safety. In the last 20 years, there's been so much modernization, so much policy, so much regulation, nothing to show. All policy up there, nothing happening on the ground. We can't modernize our way out to food safety, especially in Southeast Asia. There's this sort of focus on if we only had a modern food system, if it was all hypermarkets and cold chains and slaughterhouses killing 50,000 pigs a day, how safer our food would be. In fact, the evidence we have suggests it's the worst. Modernizing often makes food less safe. Okay, if we can't regulate our way to food safety or modernize our way to food safety, can we train our way to food safety? And that's always been the default for the development world, of which, of course, I'm part. And the evidence is absolutely not there. Training by itself never works and never makes food safer. However, the good thing about training is it's pretty harmless. In most of the countries where we work, people get paid to be trained. I mean, that already tells you something about how much they value the training when you have to round them up, feed them and pay them in order to get them trained. But at least it's not making things worse. Whereas the modernization and the regulation, we can show it's making things worse. Regulation is particularly bad because it tends to just grow and grow like some horrible snowball running downhill. Always new approaches, always new regulations, while the dead regulations and the zombie policies remain littering the landscape, creating this jungle which traps consumers and entrepreneurs because there's no way out of it. And everywhere is somebody setting up a toll booth, trying to get their money, trying to get their share, trying to generate income from regulation. We heard yesterday there was a nice remark about if you have one big pot of stew, you're not going to one corner of that stew, which is good, and the rest of that stew, which is not very good. So dead regulations, capture. And then, so what can be done? I mean, I think the main lesson is that we do not have solutions for food safety in informal markets where the great majority of the foodborne disease burden occurs and which are going to persist. On the whole, some countries are more formal, some countries are less, but informal markets are going to be the main source of food for decades to come. We sometimes say pilots never fail and pilots never scale. So there's lots of little examples where things get better in the short term, or get better in a very small place, or get better until somebody wrote up the paper and published it. But we don't have solutions that scale and are sustainable for informal markets. We do have some promising things. And at ILRI, we sometimes call this the three-legged stool approach. And we say these three things, if you get them right, you may have a chance for a sustainable and scalable solution for wet markets. The first is capacity and technology. I mean, people can't make things better if they don't have anything to make things better with. So there does need to be information, there does need to be skills building, and there does need to be technology, sometimes very simple, just like little things like, putting small amounts of bleach to clean surfaces. And then there needs to be an enabling environment. Too often, the regulation is the problem. The decision makers are making things worse. They are not the solution. At the moment, if you've got, I'm coming to the end, but I just want to give you an example from Kenya, that if you've got a very long value chain, very unsafe farms, some of the best thing you can do with your milk is to put in a couple of drops of hydrogen peroxide. I was reading in the Daily Nation, a guy is now doing 2 years in jail because they found him putting hydrogen peroxide in his milk, and they said that's adulteration. It made the milk much safer at the end of it. So this is a question where regulation is not making things better. And there's so much conflict of interest. There's so many vested interests. Listra talked about that. We heard about that from Renata, that in these areas, and I think Elizabeth will talk to that too, that really it's a very messy area. So what do we need? I said some capacity and some technology. That is the ground. An enabling environment. Often that means less regulation and allowing things not to be regulated. An enabling environment. And part of that is also some provision of infrastructure. Roads, electricity, whatever. We won't get our food supply really safe unless we've got some basic infrastructure. But the third and the most important and the most ignored is motivation. Nothing is going to happen unless there is incentives for behaviour change. And those are what is usually ignored. And when they are thought about, it's often this naive assumption that you'll get more money if your food is safe, which does not hold in informal markets. But when we are looking at it, there are a complex range of social, psychological, normative incentives which could actually make people do things differently, or nudges, or changing the choice architecture. Just to give an example from Kenya, we worked with informal dairy sector, which the milk was very unsafe. We helped train them and give them some simple tools. They got the milk safer. It always happens in the short term. What made it work in the long run was that they were able to use the certificate of training as a way to stop them being harassed by the authorities. And that gave them enough motivation to keep putting their training into action. So a non-monetary incentive, but a very powerful one. So that's a quick 5 minutes through food safety in informal markets in Africa and Asia.
Wow. Can I just say I'm very happy to have been chosen as moderator at this panel. It is a very interesting panel, and that was two very interesting talks so far. I'm really looking forward to the discussion. I have a couple quick follow-ups for you. One is there is this been a push to improve food safety for trading purposes. How has that affected food safety in the informal market?
So this was one of the interesting things. It's like people for years had always been saying there'll be spillover effects. Why? Because, obviously there'll be spillover effects. And then finally the STDF in Europe did the first ever study to see were there any spillover effects. And the answer was there aren't any. So basically it's totally hermetically isolated sectors. You can improve food safety a lot in trade without doing anything from developing for the informal markets. And you could also argue that trade is sucking in competent people and capacity to regulate into places where there is effective third-party certification checking is the food safe, which is leaving a desert in the rest of the markets, which is, and you saw the study we presented, $100 billion a year from the cost of foodborne disease in domestic markets, 10 billion from the cost of illness, 5 billion from trade. So, yeah, that's where our focus should be.
Let me just circle back to your sort of very negative view on regulation. So, as a former regulator myself, just pondering this a little bit, I tended to think of good regulation and bad regulation. Is it the very fact that the state is setting food standards that you object to, or is it the fact that the way it's been implemented has made things worse? Do you see any role for state, or agency activity to help with the informal market?
Yes, I must say I was deliberately being a little bit provocative. Certainly, regulation needs to be there. Everybody kind of understands that. It's the same way we need laws against murdering people. We do need some laws against things. But in our experience, and we've been looking at this for a long time now, a lot of regulation probably makes things worse rather than makes things better. So on the whole, in most low and middle income countries, it doesn't have to. There would be ways of doing regulation that would make it much less harmful. But it's also, just quickly, like one of the things and it takes us back to, vested interests and political economy. So in a country we work in, the dairy industry has been continuously consolidated and now is 80% owned by the president's family. And that's the formal dairy industry. The informal dairy industry is more than 90% of the milk being sold. The regulators fight hard against the informal sector, arresting people because they say they're making people sick. The milk sold in the formal sector costs twice as much as in the informal sector. So if you're a mother trying to feed your child, and milk is one of the best things you can give a kid to help it grow, should you get from the informal or should you pay double to get the president's milk? What's the trade-off there? And when we actually look at the safety, when we do the quantitative risk assessment, they're comparable. There is no health benefit from drinking formal milk.
Well, I'm really looking forward to the discussion. I could ask you about 20 more questions right now. It looks like we're joined by Dr. Henson. Is that true? Excellent. Dr. Henson, can we see if your volume is working there?
There we go.
Oh, excellent. I think I'm going to go to you next for maybe just a few minutes of introductory comments to kind of frame out your perspective.